Hello and welcome back. Today we are talking about a condition that has been troubling humans for centuries gout. If you have been diagnosed or just curious about this incredible painful form of arthritis, this video will walk you through everything you need to know from what causes it and how it feels to how it's diagnosed, treated, and prevented. So, let's get started. Gout is a type of inflammatory arthritis that causes sudden and very painful attacks, usually affecting a single joint, most often the big toe. These attacks come on quickly, often at night, and the pain can be so intense that even the touch of a bed sheet can feel unbearable. The underlying cause is the build-up of sharp uric acid crystals in the joints, triggering inflammation and pain. Uric acid is a natural waste product made when your body breaks down substances called purines, which are found in certain foods and also produced naturally in the body. Normally, uric acid dissolves in the blood and gets excreted through the urine. But in people with gout, either the body produces too much uric acid or the kidneys cannot get rid of it efficiently. This extra uric acid forms crystals that settle in the joints, and that's what causes those painful flares. There are several things that can increase your risk of developing gout. First, genetics. If you have a family history of gout, you may be more likely to get it. Diet plays a big role too. Foods high in purines like red meat, seafood, and alcohol can raise uric acid levels. Obesity increases both uric acid production and stress on your joints. Medical conditions like high blood pressure, kidney disease, and diabetes also contribute. Some medications like diuretics and low dose aspirin can increase uric acid. It's more common in men and postmenopausal women. So, how does gout actually feel? The symptoms often start suddenly and usually at night. You might feel a sharp, intense pain in a joint, typically the big toe. The joint will often be red, swollen, warm to the touch, and extremely tender. The pain can last for several days. As it starts to fade, the skin over the joint might peel or become itchy. Although the big toe is the classic side, gout can also affect the ankles, knees, elbows, wrist, and fingers. Gout progresses through four main stages. First, there is asymptomatic hyperuricemia, where uric acid is high but there are no symptoms. Then comes acute gout, which is the first painful attack. After that, you might enter the intercritical period, a gap between attacks when you feel fine. And finally, chronic tophaceous gout, where repeated attacks lead to permanent joint damage and visible uric acid lumps called tophi. To confirm gout, your doctor may start with your medical history and symptoms, but they will usually want to run a few tests. The most accurate test is joint fluid analysis, where fluid is taken from the swollen joint and examined under a microscope for uric acid crystals. A blood test can show high uric acid levels. Ultrasound or dual energy CT scans can spot crystal deposit. In chronic cases, X-rays can help assess damage to the joints. Several other conditions can look like gout, so it's important to rule them out. These include pseudogout, which is caused by calcium crystals, rheumatoid arthritis, an autoimmune condition, septic arthritis, a joint infection, and bursitis, which is the inflammation of a fluid filled sac near the joint. Accurate diagnosis is key to getting the right treatment. When a gout flare happens, the priority is quick relief from the pain and inflammation. Doctors usually recommend NSAIDs like ibuprofen or naproxen, colchicine especially if taken within the first 24 hours, or corticosteroids like prednisone, either by mouth or injection. Early treatment can shorten the attack and ease symptoms within a few days. Now, let's talk about preventing the future flares. If you have had multiple gout attacks or have tophi or joint damage, your doctor may prescribe medications to manage uric acid levels. Xanthine oxidase inhibitors like allopurinol or febuxostat help reduce uric acid production. Uricosuric agents such as probenecid help your kidneys get rid of uric acid more efficiently. Pegloticase is an IV option for people who don't respond to other medications. These are usually started after a flare has resolved, and your doctor will monitor your uric acid levels regularly. Managing gout is not just about medications, your lifestyle matters too. Diet. Cut back on purine rich foods like organ meats, shellfish, and limit sugary drinks and alcohol. Hydration. Drinking plenty of water helps flush out uric acid. Weight management. Losing weight reduces stress on joints and lowers uric acid. Exercise. Gentle activities like walking or swimming are great. Avoid triggers. If you know certain foods or medications causes flares, steer clear. If left untreated, gout can cause serious problems. Toffee. These are visible lumps of uric acid crystals that form under the skin. Joint damage. Repeated inflammation can destroy the joint. Kidney stones. Uric acid can form crystals in the kidneys too. Overall, it can significantly reduce quality of life due to pain and limited mobility. Gout can affect different people in different ways. In women, there is crisis after menopause due to lower estrogen levels. In older adults, it might affect multiple joints instead of just one. People with kidney disease need careful medication choices to avoid complications. So, treatment plans should be tailored to each person's specific needs. Prevention really is the best approach. Monitor your uric acid levels regularly. Stick to a gout friendly diet. Take your medications consistently. Stay physically active and maintain a healthy weight. And always stay hydrated while limiting alcohol and sugary drinks. Living with gout can feel overwhelming, but sport and education make a big difference. Keep a symptom diary to track your flares. Join sport groups or online communities. Communicate openly with your doctor. Learn about your medications and how they work. Stay up to date on new treatment and self care strategies. To wrap it up, gout is a painful but manageable form of arthritis. With early diagnosis, appropriate treatment, and healthy habits, you can keep flare ups at bay and protect your joints in the long run. That's it for today. Thank you for watching this video. If you found this video helpful, give it a thumbs up, share it with others, and don't forget to subscribe for more medically accurate content. Stay healthy, stay informed. I will see you in the next lesson.